and welcome to this podcast for the University of Alabama at Birmingham's CounterACT Research Center of Excellence in Arsenicals. My name is Mina Nabavi, and I'm a program manager in the UAB School of Public Health. Today on the podcast, we are joined by Dr. Ziad Kazzi, Associate Professor of Emergency Medicine at Emory University and consultant with the UAB CounterACT Center. Dr. Kazzi has been a guest on this podcast many times, and we are happy to have him back to talk about toxic gases and countermeasures today. So, Dr. Kazzi, thank you so much for being here and taking time out of your busy schedule to talk to me.
It's my pleasure, Mina.
So to get us started, when we say toxic gases, what do you mean by that? Can you provide some examples?
That's a great question, Mina. And as a matter of fact, the term toxic gases is actually quite broad and is not very specific and can mean numerous numbers of chemicals. But for us in the medical toxicology or emergency medicine community, when we think of toxic gases, we are referring to toxic chemicals that are usually affecting the victims or the patients by the respiratory route. So these are chemicals that are in a gaseous form, inhaled by a victim or a patient, and causing toxicity in that manner as a primary route of action. Now, that doesn't mean that they're all gases. They could be liquids at room temperature, and then they can become gases if heated up, for example. A great example of a toxic gas is chlorine or phosgene. These are industrial chemicals that have multiple industrial applications that can become gaseous depending on the environmental conditions, and they are inhaled by people. And when they are inhaled, they are going to cause toxic effects on the person, starting with the lungs and the airway. And some of these also have systemic effects way beyond the respiratory tract and the lungs into the body. Another example of toxic gases is sulfur mustard. Now, you have to be careful with sulfur mustard. It is a liquid and it's not very volatile. However, in a hot environment, you will have inhalational exposure to sulfur mustard. And therefore, you could classify sulfur mustard in that condition as a toxic gas. Another example is lewisite. I know our center in Birmingham and Alabama focuses on lewisite and arsenicals. Now, lewisite is a great example because it's more volatile than sulfur mustard and therefore could be inhaled and cause toxicity through that route. Other chemicals that come to my mind are methyl isocyanate or MIC. Methyl isocyanate is important because it was implicated in the Bhopal disaster and led to thousands and thousands of injuries. As a matter of fact, probably the largest chemical disaster that has ever occurred was in Bhopal, India, from methyl isocyanate that was actually stored in liquid form, but then it was released in gaseous form and affected the surrounding communities.
So you kind of, my next question was about route of exposure, which you've answered, but can you talk a little bit more about side effects of exposure? And I guess that depends on the specific chemical or gas, right?
That is correct. Although, traditionally, when you think of toxic gases, you are trying to highlight their primary effect on the respiratory tract. So let's divide up the respiratory tract into the upper airway and the lower airway. Let's think of the upper airways, including the nose, the mouth, the throat, and then think about the lower airway as the lower parts of the trachea, the bronchi, as well as the lungs. And essentially, these are vital. This is a vital system for us. If you close that system, if you close the airway, you can imagine what happens to the victims. Essentially, they are going to have trouble breathing, and they will die. And if the exposure is severe and the occlusion or obstruction of the airway is rapid, then you can have rapid onset of death from these exposures. Now, these chemicals vary in their properties, as you mentioned. However, one property I would like to point out to our listeners today is water solubility. If a chemical is very water soluble, it is going to react rapidly with water, and water starts being in contact with these chemicals as early as the nose and the mouth. So a highly water-soluble chemical is going to react rapidly as soon as it contacts water or humidity in our upper airway, in our mouth or nose, and it's going to hydrolyze. When this chemical hydrolyzes and reacts with water, it will release acid. This acid is going to cause a rapid onset of symptoms. So you will know rapidly that you are being exposed to something because you're going to feel a burning sensation in your nose, in your throat, in your mouth, and then in your trachea, you're going to start coughing. So this is a good thing because it is going to alert you that you are being exposed to a toxic chemical, and it's going to make you leave that area and therefore decrease your exposure risk. Now, these are the highly water-soluble chemicals, as well as the intermediate water-soluble chemicals, such as chlorine. And you may have experienced this without knowing. If you enter to a pool house where there is a pool that's an enclosed space that has recently been cleaned or disinfected with chlorine, you may smell chlorine, and then you may have some irritation to your eyes, where you have water, your mucous membranes, your nose, your mouth, and your throat. If you are asthmatic, you may start having some cough, and you may start having an asthma attack. Now, that's an example of a highly water-soluble or intermediate water-soluble chemical.
I was just going to say that's a great example for, most people who have experience coming into contact with high levels of chlorine in a pool.
Yes, and of course, another classic chemical would be ammonia. Now, that has these same properties. Now, compare and contrast that with chemicals that have poor or low water solubility. Now, think about the same chemical reaction I just described to you happening in the throat or in the eyes with these low water solubility chemicals. These reactions are very slow. So they will release acid. The acid will burn, but it will take some time. And this time will allow the chemical to seep deep into your airway, into your lungs, before you actually realize there's something going on by having burning in your eyes or throat or mouth. And therefore, you are less likely to run away and less likely to remove yourself from this toxic exposure. A classic example of these low water solubility chemicals is phosgene. Classically, phosgene patients will develop more predominantly toxicity and injuries in their lower airway system as well as their lungs. Now, that doesn't mean that chlorine, which is intermediate water solubility, or ammonia, which is high water solubility, do not cause lower airway damage as well. They do. And we've seen that in Grantsville, South Carolina, in the train derailment. We've seen that in Syria and in Iraq with the chlorine use in terrorism and warfare. And we've seen them affecting the lower airway, because remember, at the end of the day, if you have a large exposure, you are going to affect the upper and the lower airways. But classically, you separate these chemicals in terms of their water solubility and try to look for these upper airway predominant manifestations versus the lower airway manifestations. And I hope, I'm sorry, this may be too long, but I think this is a essential principle for our listeners to grasp today.
No, you've done a great job of explaining that. So thank you for taking the time. Are there any, I know you've talked about the respiratory tract, but are there any other impacts to the body or side effects to the body from inhaling these gases? Or is it mainly the respiratory system?
Some of them do have effects beyond the respiratory system. Some of them are limited to the respiratory tract. For example, as I said, sulfur mustard, which is of high interest to us in Alabama, is going to have the respiratory effect, but it can also have the dermatological effects that we have discussed in previous webinars. It has also its effects on the kidneys, and I know we've discussed that as well. And I know Dr. Arthur is going to discuss on August 19th, the skin effects in more detail of sulfur mustard and lewisite, which again shares these same capabilities as sulfur mustard. So yes, some of these have effects beyond the lungs. Even if they are absorbed through the lungs, they can have systemic effects. Think of hydrofluoric acid. Think of hydrofluoric acid ability to cause electrolyte abnormalities. Even if you just inhale it, you may potentially develop life-threatening hypocalcemia and hyperkalemia, even through that route. And they can also have their own effect on the skin. If spilled on the skin or if ingested, they can all be absorbed as well in these situations. But not every chemical has these properties. So chlorine, for example, would not have these systemic effects. It will exert primarily its effect when you inhale it on the lungs and upper airway.
You've mentioned a couple examples, but could you talk about how and where these chemicals have been used? I know you've mentioned Bhopal earlier. You briefly talked about Syria. Can you talk about a couple of examples of where people have been exposed to these types of gases?
Certainly. Now, these examples you refer to, Bhopal is an industrial accident. What happened at a plant that was manufacturing a carbamate insecticide, and they were using MIC or methyl isocyanate for the production of that chemical, and they had this disastrous release in that remote or this underserved community with a lot of people living really close to the actual industrial plant. And they were really exposed to very high temperatures, very high concentrations of this chemical and suffered greatly from it. In Syria, we've seen the use of chlorine, we've seen the use of sulfur mustard, dispersed, targeting civilian populations and causing, thousands of injuries and death. But I want to maybe give you other examples that are more common, day-to-day examples, everyday examples. We do see occasionally people exposed to chlorine gas when they are working with their pool. If they're, they call it shock your pool, they're shocking their pool and they don't do it properly, they can release chlorine gas that affects them. There are also examples of people getting exposed to this at home, not in a pool. It's basically inside your home when you are trying to clean. And we've all, cleaned more than we usually do during the past year and a half to disinfect SARS-CoV-2 and prevent COVID-19. So we've used a lot of these chemicals. We've used bleach, which is also going to potentially release toxic gases, especially when you mix it with other chemicals. So another important lesson to our listeners today is do not mix chemicals together. I know in my family, my mom used to believe that if you mix two chemicals, you can make a stronger chemical, and that's not true. You can actually release toxic gases. A great example is if you go ahead and mix bleach with ammonia, you can release chloramine, and chloramine gas is similar to chlorine gas. So you can even release chlorine when you're mixing bleach with another acid. So please don't mix chemicals together. Always follow the instructions on the label. And always clean the surface, wipe the dirt off the surface before you apply the chemical, because sometimes the chemical will react with the dirt material that you are trying to clean. And certainly be careful when you use these chemicals. Always think about ventilation, try to open the windows, and try to, make sure you don't expose yourself or others to these chemicals when you use them, especially in an enclosed setting like your home.
I like that you've mentioned that this is not just a risk to people working in industries or industrial sites, but in their home doing everyday chore type activities and cleaning. So would an N95 mask, which we've heard a lot about the past year or so, would that protect against a lot of these gases?
Unfortunately not. I mean, I think, well, first of all, if it's a pure gas that you're inhaling, an N95 definitely will not protect you from gases. You will need a respirator for these type of situations that is properly fitted, that is going to basically provide you with your own air supply. And we call those self-contained breathing apparatuses, or SCBAs. This is for gases. Now, if you are concerned about inhaling toxic vapors, there are more, the level C air purifying respirators. Those are going to have a cartridge, and the cartridge would be able to filter out these vapors, these toxic vapors. But an N95 is not tested for these type of things, and N95 is meant for particles, toxic particles, or infectious particles. And you need really a properly fitted, properly selected cartridge filter that you would wear, that you would use in your air purifying respirator or in your powered air purifying respirator or PAPR to protect yourself from these toxic vapors. But again, if it's a gas, we have to remember that if it's a toxic gas, like say, for example, hydrogen cyanide gas, an air purifying respirator or a PAPR with a cartridge would not protect you because the gas will enter through the cartridge filter and expose you. In these cases, you do have to wear your self-contained breathing apparatus.
So what countermeasures exist for some of these chemicals, and are they readily available?
Well, as you mentioned earlier, there are, of course, numerous chemicals, right? So it depends on the chemicals. There's no like one chemical, and there's no medical countermeasure.
It's not a one-size-fits-all sort of thing.
When you look at the field of development of these countermeasures for these types of chemicals, in general, it is fair to say that there is a paucity of medical countermeasure options. Of course, the basic supportive care is always is going to apply and it's going to be important, especially with these toxic gases. Attention to airway, securing the airway, preventing airway obstruction by an intubation, what have you, to protect the airway, oxygenation and ventilation, even before the airway and before oxygenation and ventilation, removing the patient from the exposure. So evacuating the patient from this environment where these toxic gases are present. And then supportive care. Now, like I said, when it damages the lungs, there are some adjunctive therapies that are used, such as steroids. We've all heard about steroids recently being used for COVID-19. There's also sometimes nebulized bicarbonate when you inhale chlorine, for example, may help with the symptoms a little bit. But there's a need for development of additional countermeasures. Now, our center in Alabama is working on this, actually leading the development of some of these countermeasures for arsenicals, as you know. So that's for lewisite and other arsenicals. There are other scientists that are developing countermeasures also for these toxic gases. They are looking at other type of therapies. And again, depending on the agent, the NIH, National Institute of Health, does fund several excellent research programs that are working hard to understand the molecular mechanisms and toxicity mechanisms of these chemicals, and with that, be able to discover therapeutic interventions that can either treat or prevent toxicity from these notorious chemicals.
So I have one last question, and you kind of touched on it a minute ago about, what should someone do if they suspect exposure? Remove them from the location, make sure there's proper ventilation. Is there anything else that someone should do if they suspect exposure?
I think if they suspect exposure, it's important to, like I said, leave the area or ventilate the area. We did not touch much on decontamination. That's also important and part of the initial care of patients that are exposed to these. Now, when they are purely in their gaseous form, decontamination is less important. However, like I said, some of these are often called gases, but they are also vapors, and these vapors can actually require skin decontamination with soap and water, of course, removal of clothing. That's also important depending on the situation. And then, seeking care to make sure your airway is okay, make sure your lungs are okay, your oxygenation is okay. Keeping in mind that most of these will cause their toxicity relatively rapidly. And, you will know if a patient is going to be, ill from this exposure by observing them, 6 to 8 hours. You should be able to get an answer, with some exceptions. You have some other chemicals that are going to have more delayed onset, such as phosgene, also sulfur mustard, and arsenicals may be a bit more delayed than your typical chlorine exposures. So appropriate assessment and management in the emergency department with consultation with a poison control center or a medical toxicologist to decide on the disposition, whether you go home with instructions to come back or would you basically stay overnight. The role of steroids, the role of sodium bicarbonate by nebulizer, the role of antibiotics, all of that is not very well studied. Certainly antibiotics are not indicated unless you really have signs of an infection. But all of that, all these treatment decisions would result from a cautious and thoughtful discussion between your emergency physician, your pulmonologist, your medical toxicologist, and then as the disease course progresses, the management will have to evolve as well, adapt to it.
So a whole team of folks.
Absolutely.
Well, I think that's all of the questions we have time for today. Dr. Kazzi, thank you so much for being here and providing me and our listeners with so much great information about this topic.
Thank you so much for having me.
And thank you to our listeners. Please tune in next time for another episode from the UAB CounterACT Research Center of Excellence in Arsenicals.